gentlemen of the jury, the witness, by agreement, their deposition was taken since they were unable to be here this week or some reason that the party's aware that they couldn't be here. So that's going to be played for you, and you can analyze that testimony as you would if the person was here and live and in person. Okay.
Judge, I'm sorry, we had a recording done of this witness. I don't know. I think this is the
What did you say?
That's not how we had the deposition recorded, but if it, I don't know if it's.
That's the court reporter's recording.
Correct. We had somebody from our office that came and videotaped it.
Is this not, okay?
I don't know. I haven't seen this, but I'm sure it'll be fine.
Oh, all right.
Just for the record, this is the deposition of Alyssa Smith related to State versus Blaise Taylor on Friday, April 17th, 2026. Ms. Smith, could you please state your full name for the record?
Yep, Alyssa Smith.
And could you spell your first name for the court reporter?
Alyssa.
Ms. Smith, where are you employed?
Vanderbilt Lifeline.
And you said Vanderbilt Lifeline, is that correct? Can you explain what is Vanderbilt Lifeline?
We provide pre-hospital care across a bunch of different service lines, from events to flight to ground transports.
And what is your position?
I'm a critical care paramedic.
Can you explain what the critical care paramedic does?
We provide life-saving interventions in a pre-hospital setting.
And that pre-hospital setting, can you describe, are you on an ambulance or some type of vehicle, or where are you normally physically working?
In my current role, I could be positioned on an ambulance, or I can just be in a venue. It just kind of depends on my assignment.
And would you ever sometimes be at Vanderbilt University Medical Center?
Working currently, no. We're not working at the hospital.
And how long have you been in that position at Vanderbilt?
In my current role since fall of 2023.
And prior to fall of 2023, what did you do?
I was working in the ER at Vanderbilt Adult.
And what was your position in Vanderbilt's emergency department?
Paramedic.
And can you describe what was your role in patient care when you were a paramedic in the Vanderbilt emergency department?
We were mostly support for the nurses. Anything that they would need, IVs, medications, we would work traumas, anything that would come in. We were just kind of support for the doctors and nurses there.
Okay. And that position is an EMT position, but it's a position at Vanderbilt Hospital. Is that correct?
Yeah, it's a paramedic position.
And so there are other paramedics that would work for National Fire Department with ambulance services. Is that correct? Mm-hmm. Okay. And specifically, were you working in that position as an EMT at Vanderbilt Emergency Department in February of 2023?
Yeah, I was working as a paramedic.
And were you working specifically on the night of February 25th, 2023 into the early morning of February 26th?
I was.
And while you were working, were you involved in providing any patient care to patient Jade Benning?
I don't remember.
In preparation for testifying today, did you review records to verify whether or not you were involved in any patient care related to Jade Benning?
Yes.
And were you involved in any way?
Yes.
And specifically, did you ever administer fentanyl to Jade Benning? And did you review records related to whether or not you administered fentanyl to Jade Benning?
Yes.
And in the records, there is an entry from February 25th, 2023 at 23 and 27 hours that indicates that fentanyl was dispensed. Did you review those records?
Yes.
And can you explain, what does it mean when a medication is dispensed?
When we are pulling it from the medication dispensing machine in preparation to either have it on hand to give or to give to the patient.
And did you locate in the records whether or not you actually administered that fentanyl that was dispensed at 23 hours and 27 minutes on February 25th of 2023?
No.
And no, you didn't review the records, or no, it wasn't?
It wasn't administered.
Okay, so it was not administered.
No.
Did the records indicate what happened to that fentanyl that was dispensed?
It was wasted.
And can you explain why would it be wasted, and what does that mean?
Yes, on the note on the document, it states that patient condition changed.
And so that fentanyl specifically was not administered to the patient, is that correct?
That's correct.
If I can have just a moment. Thank you, Ms. Smith. I don't have any other questions.
Ms. Smith, good morning.
Good morning.
My name is Letitia Quinones-Hollins, and I'm going to be asking you some questions. If at any time you don't understand anything or you feel like I need to rephrase, please let me know, and I'll do my best, okay? I want to talk to you a little bit about your background. Are you from Nashville?
I'm not.
Oh, where are you from?
Arkansas.
Okay. And what part of Arkansas are you from?
Jonesboro.
When did you come to Nashville? When did you come to Nashville?
Fall of 2021.
Okay, did you come here to go to school?
Yes.
And what school did you attend?
Nosy College of Art for my bachelor's in photography.
I'm sorry?
Nosy College of Art.
Nelsie?
Nosy.
Spell it for me.
N-O-S-S-I.
Oh, Nelsie, okay.
Yeah.
College of Art? And you got a degree in photography? Would that be a bachelor's? And what did you do after you graduated? What year was it that you graduated?
May of 2025.
So just last year. Congratulations. How old are you?
Thank you. 26.
26. And so then if we go back to 2023, were you in school then? You have to speak out loud so she can see.
Sorry, I'm
That's
so
okay.
sorry.
Yes. Okay. And what year were you then?
What age was I?
No, what year of college were you?
Okay. I started in fall of 2021.
Okay. And went straight through. Okay. When you were doing your studies at Nosy College of Arts, did you get any type of training in any medical training there?
From the college, no.
Okay. And did you get any type of medical training anywhere?
Yes.
And where was that?
Arkansas State University.
Okay. So I'm assuming before you came to Nashville, you were also in school in Jonesboro.
Yes.
At Arkansas State.
Yes.
And what were you studying there?
That's where I obtained my EMT basic and my paramedic license.
How long does it take to get EMT and paramedic license?
EMT is typically a semester, paramedic is typically 12 months straight through.
Does the semester that you take for the EMT go towards the year to become a paramedic as well? So they're separate and apart.
Yes.
And so then that would be a year and a half that you studied in order to become an EMT and a certified paramedic as well.
Yes.
What is the difference between an EMT and a paramedic?
Scope of practice.
Scope of practice? What is the difference in the scopes?
A paramedic is able to treat and do more, interpret 12 leads, start IVs, administer medications.
Things of that nature?
Yes.
And an EMT is only able to do what?
They're typically the driver, and they're there to support their medic and, anything they can help them do during treatment.
Okay, fair enough. They are not allowed to administer medication?
Tennessee is different with advanced EMTs. I was a basic in Arkansas, so I know they're allowed to do some here. I don't know because I was never an advanced.
Okay, sounds good. So as a paramedic, though, you were able to administer medications.
Yes.
What year did you receive your paramedic certification?
2021.
So right before you came to Nashville to start at night.
Yes.
And when you came to Nashville to start at school, I'm assuming you started as a freshman or you had credit already?
I had transfer credits.
Okay. Were you still a freshman?
Yes.
And were you working during that time?
Yes.
Okay. And would that be 2021?
Mm-hmm.
And where were you working?
When I first started school, I was at Emerson Ambulance back home, and then I started working at Hobby Lobby for a little bit to take a break.
One of my favorite places. Okay. And what about when you came to Nashville?
That Hobby Lobby was here in Nashville.
Oh, hi. Okay.
Yeah.
How long did you work at Hobby Lobby?
Roughly 5 or 6 months until I started at Vanderbilt.
When did you, so did you have any employment between Hobby Lobby and Vanderbilt? Okay. When did you start at Vanderbilt?
March of 2022.
And what position did you start off?
A paramedic.
Paramedic. What department? Would that be emergency?
Yes.
Did you work in any other department at Vanderbilt outside of the emergency department before February 2023?
No.
Okay. So by the time that by the time it's February the 25th of 2023, you have been at Vanderbilt working as a paramedic in the emergency department for almost a year.
Yes.
Is that fair?
Yes.
And I'm assuming you were going to school during the day
Yes.
and then working at night.
Yes.
What were your hours during that time?
If it was I started on night shift from 7P to 7A,
Okay.
and I moved to a mid shift from 3P to 3A at some point. I think I was working mid shift by then.
Okay. So 3 p.m. to
3 a.m.
And I'm assuming you guys work 12-hour shifts. How many days per week were you working 12-hour shifts?
3 to 4.
So it's full-time and full-time student.
Yes.
Good deal. Could you tell us exactly what your title was from March of 2022 to February of 2023?
Paramedic.
And nothing else in between?
No.
Did you hold any supervisory roles or anything of that nature?
The last 2 months that I was employed in the ER, I became a paramedic lead.
Okay.
That's it.
And can you tell me when would the last 2 months be? I know you said
August and September. I left September 24th.
September 24th. So September 2024, that's when you moved to your current position.
2023.
23, I'm sorry. Okay. So September of 2023 is when you left the emergency room department and came to your current position.
Yes.
And your current position again is?
A critical care medic for Lifeline.
Is that viewed almost as if it's a promotion, if you will? Or it's just like a lateral move?
Lateral transfer.
Okay. In your position as a paramedic in the emergency department back in 2023, February, tell us exactly what your daily, average day responsibilities were.
So I would come to work, clock in, check off all of our equipment throughout the department, look at the board, see what patients we had, get off-going shift report from off-going paramedics, and just help wherever the nurses need me and whatever I was told to do.
When you say check equipment, what type of equipment are we talking about?
Our crash carts, our trauma equipment, all of our cabinets, all of our carts, make sure everything's stopped for the shift.
Okay. And is medication in any of these cabinets or no? So what would be in your carts and cabinets and things of that nature?
IV supplies, I'm trying to think, like bandaging things, basic things.
Almost like support supplies for the nurses and things of that nature. Okay. So you will come to work, you check the equipment, see what patients are there in the emergency room, and then I'm assuming you then wait for someone to give you instruction as to where they would need your support.
Yes.
Who would primarily be the people who would come to you and ask you for support? Would it be the nurses, doctors,
Yes.
both?
Yes.
Okay. Was there a particular doctor and or nurse that anyone was assigned to?
No.
It could be anyone.
Yes.
How many, if you know, how many nurses would you say would be on duty at any given time at Vanderbilt's emergency back then?
I do not know.
You know? Okay. Do you know how many patients the emergency room department, in terms of rooms, how many rooms of patients do you guys take there?
I don't have an exact number. I know we go up to 38, like physical rooms,
38?
but it could be more. I'm not 100%.
Yeah, I've seen sometimes where they have patients in the hallways because they're running out of rooms. Who would have been your supervisor back then?
As our paramedic supervisor, it would have been Eric Frank.
Eric Frank? Did you guys have more than one supervisor?
For paramedics, no, he was our overall paramedic lead.
So outside of Mr. Frank, everyone was in the same role and position?
Yes.
Were you supervised directly by any doctors and or nurses?
No.
And so you, on February 25th of 2023, I'm assuming based on your prior answer, the only reason you remember that you were working that particular day is because you checked the records.
Yes.
And that makes sense, right? It's 3 years ago. You're stating that you were on duty there from 3 p.m. to 3 a.m. during that time?
I believe if it was my normal shift, then yes. I don't know exactly what my shift was.
And do you remember at all Ms. Benning coming to the emergency department on that evening?
I do not.
Do you remember which nurse and or doctor that you were working with on that day?
I do not.
Do you remember whether or not during that time that there were more than 38 patients, or it was pretty hectic during that time, or if it was just a normal call day? Do you remember anything like that?
I do not.
I should probably just ask you this. Do you remember anything about that day?
I do not.
And trust me, it's fair. That was 3 years ago, so that's fair. Okay. During your position and your daily duties at the emergency department, do you ever have interaction with family members or things of that nature?
Yes.
And what type of interactions would you have with individual patients, family members, and things of that nature?
If they're in the room treatment plan of what we're doing and what's going on and everything.
Would you be the individual that communicates that treatment plan to the family members?
It's typically the MDs, but if we come in and we start doing something, that's when I would explain what was going on.
And when you say that you would explain what was going on, you would explain what?
Like, hey, I'm about to start an IV.
Okay.
Typical things.
Not what the doctors are going to do, just this is what I'm going to do.
Correct.
Now, do you have any authority to, on your own, determine what type of medication a patient should receive?
Not in the ER.
Not in the army, okay? Do you have on your own any type of authority as it relates to any type of treatment, not medication, but an IV and or a bandage or anything like can you assess a patient on your own and say, this patient needs an IV or this patient needs a bandage?
I have to obtain orders from the doctor.
I'm sorry?
I have to obtain orders from the doctor.
From the doctor.
Yes.
Can you obtain those type of orders from a nurse?
No.
Only a doctor.
Yes.
And so when you looked at the records for Ms. Benning back on February 25th of 2023, I'm assuming you noticed, like we all, that you had pulled some medication that day. And you said before that you dispensed medication.
Yes.
Tell us again exactly what dispense means in the EMT emergency room department world.
Pulling it from the machine that stocks it, where it's stored. Just pulling it out of the machine.
Okay. And so if anyone is like me, what do you mean pulling it out of the machine? What does that mean?
We go in, type in the patient's name, type what medicine we need, and pull it out of the machine, and we have the medication now.
Okay. So I'm assuming then there's some type of machine that houses medication.
Yes.
And that machine, does it house all medications or only controlled substances or things of that nature?
It houses all medications. It's not only controlled substances.
Okay. And so if you are dispensing, which we now know the EMT emergency room department world means pulling it out from the machine that houses the medication for the emergency department, we can assume, can we not, that a doctor, because you said you cannot take orders from a nurse, right, that a doctor had to have told you to do so.
Correct.
Because you otherwise would not get medication out of them.
Correct.
What credentials must you put in order to obtain those medications?
The patient's name and the first 5 letters of the medication you're trying to access.
Do you have to give any identifying information from you?
Yes.
Okay. Tell us what that is.
It's our login, our ID, and our password.
Anything else besides your ID, your password, the name of the first 5 letters of the name of the patient, and the actual medicine?
It's the first 5 letters of the medication and the name of the full name of the patient.
Okay. Do you have to give the patient's date of birth?
No.
No.
Don't.
Do you have to put anything in there as it relates to the doctor who gave you the authority? And so we see that on February 25th of 2023 at 23:27, which is 11:27 p.m.,
Yes.
that you first pulled midazolam.
Yes.
What is midazolam?
Another name for it is Versed, and it's just a sedative.
A sedative, and it means that it does what to a patient?
It calms them down. We give it for seizures a lot. It just kind of relaxes their muscles.
Okay. Does it put them to sleep?
Patient dependent.
Okay, so it can make you drowsy, but it's not an agent that puts you under.
It can't. It depends on the patient. Everyone handles meds differently,
Okay.
so it depends on the patient.
Well, let me ask you this. If someone wanted to cause someone to go into an unconscious state, would they use midazolam in that type of arena to make that happen?
Yes.
And then we also saw that you also pulled fentanyl.
Yes.
What is fentanyl?
It is a pain medication.
Is it also used as a sedative?
No.
It is solely for pain.
Yes.
So one can assume then that if you are administering pain medication to a patient, then that patient had to have been in some sort of pain.
Yes.
And how would you know a patient is in pain?
They will tell us.
noticed, if I could, you reviewed your records when you
Yes,
prepared for today?
Yes.
I want to show you what I'm going to mark as I'm going to mark it once they get as Appendix Exhibit 1. Take a look at Appendix Exhibit number 1. Have you ever seen that document?
Yes.
Okay. When did you see that document?
A strip of only what I had done under my name was emailed to me.
Okay. Who was it emailed to you by?
That I do not know.
Okay. Do you, what email would they have emailed it to you?
My work email.
Your parent work email?
Yes.
Are you able to go back and take a look and see who emailed that document to you?
I don't have the ability on my phone.
Not now, but at some point.
Yes.
Okay. Do you remember when it was emailed to you?
No.
Was it this year?
Yes.
Was it in preparation for your testimony today?
Yes.
And you just don't remember who it was?
No.
Who have you been in contact with in preparation for your testimony today?
My lawyer,
Who is your lawyer?
Anthony Bills.
Have you been in contact with anyone else?
No. I got the subpoena emailed to me and that was it.
Okay. So then the only person that you've been in contact with as it relates to your testimony here today was your attorney?
Yes.
In these records, you notice that your name was present.
Yes.
Do you also notice where it states ABS override pool?
Yes.
What does that mean?
It means if we have a patient coming in or a patient that needs emergency medication right in that moment, we can go in and override and just pull the medication that we need as told by a doctor.
Okay. Why would you need to override it?
Because they don't have time to go in and put the orders in the computer. Because it's an emergent situation and something's happening that we need those medications.
Okay, so is there another protocol for or dispensing, medication outside of this ABS override that would not require an override?
No.
So in every instance that you want medication, you have to do an ABS override?
Oh, no.
Okay. So what would you do if it wasn't an override, I should say?
The orders would be put in by the physician and we would go in and be able to pull them.
Okay, so then what you're saying is that the normal protocol is that a doctor would put in orders for medication.
Yes.
And it is because of those orders that you can then go to the machine that houses the medication. Does that machine have a name, by the way?
The Omnicell.
Omnicell? O-M-N-I? S or C-E-L-S?
Yes.
So, in a normal procedure or protocol, doctors put in orders into a system. That system somehow communicates to the Omnicell
Yes.
and allows for you to go in and then put in the patient's name, the first 5 letters of the medication, your ID and password, and the medication is dispensed.
Yes.
But in this instance, for Ms. orders in the system
Yes.
for the Omnicell to recognize
Yes.
because of the emergency situation.
Yes.
And so because of that, you implemented the ABS override pool.
Yes.
Okay. And what exactly is the override pool? What do you have to do there?
We hit, it's a button, medication override, emergency, whatever the reason is for needing it overridden, so that it's all documented.
In that situation, what would the reason have been, if you know?
I don't know the exact reason.
Okay. Would it have been communicated to you?
Yes.
Okay. Who would have communicated that to you?
The pharmacist or the doctor.
Okay. Is it required for you to put in that reason every time you do an ABS override?
Yes.
Without that, you cannot administer it. I'm sorry, dispense it.
Correct.
Okay. And so then we can assume that when you did this ABS override pool, there was a reason stated as to why you were able to do that.
Yes.
When you put that reason into the system, are you also inputting the individual who communicated the reason to you?
No.
Just only the reason?
Yes.
Okay. How many doctors would you say are on duty at any given time during the 3 p.m. to 3 a.m. shift?
I don't have an exact number.
Would it be more than one?
Yes.
Okay. More than 5?
Yes.
More than 10?
I don't believe so.
Okay. So somewhere between 5 and 10. Yeah. Who would tell you the dosage of the medication?
The doctor.
When the doctor is communicating this information to you in this emergency situation where the orders are not put into the system, are you taking notes or are you just memorizing?
When we pull the medication from the Omnicell, it is the whole vial. So we go and pull the medication, we come back to the doctor and verify the dose before giving it.
Okay. So when the doctor is communicating to you before you go to the Omnicell, you're not taking notes or anything at that time, you're just remembering as you go.
The medication, yes. All I need to know is the medication.
Okay. So because we see in these records that there was a fentanyl pool, there was a midazolam pool, and an override situation, then we can, based on what you just testified here today, assume that there was a doctor who communicated this information to you in terms of what the patient needed.
Yes.
Now, when you dispense the medication, who administers the medication? Meaning, who gives the patient this medication?
Either myself or a nurse.
Not the doctor?
Typically, no.
Okay. And how is fentanyl and midazolam administered to a patient?
Through an IV.
And just so that we're clear for the sake of the jury, when we're dispensing medication in this setting, that means you're taking it from the Omnicell. When you're administering medication in this setting, you're actually giving it to the patient.
That is correct.
Okay. And so, at some point, based on your testimony, it was determined that this medication would not be given to this patient, correct?
Correct.
Okay. Now, who would have told you that? So someone had to have told you to get the medication, dispense it. Who would have told you not to administer it?
The doctor.
The same person.
Yes.
Is there anyone else who could have given you the authority not to administer that medication?
Yes.
Who?
Another doctor.
Okay, but it had to be a doctor.
Yes.
Okay. Not the RN.
No.
Or a nurse practitioner.
No.
And again, as these doctors are communicating to you, you're not taking notes or anything So it is now determined that you did not administer, the doctor makes the, based on the records, make the determination that you're not going to administer these medications to the doctor. What do you do with those medications?
They are wasted.
Are they wasted immediately?
Yes.
And how are they wasted?
We have a system in the Omni cell where we go in and waste it with a witness, and then they are disposed of. And it's called a cactus. It's a drug disposal thing that we squirt the medication into.
Okay. Is that in the Omni cell as well?
It's beside it, yes.
Right beside it. Is it a separate machine?
Yes.
Okay. And does it require any information on your part in order for you to dispose of the medication into that machine?
Yes.
And what is that machine called?
It's a non-machine. It's just a waste receptacle.
Oh, it's just a waste receptacle.
Yes.
Is that those red things you see with the danger?
A little different.
Okay. Okay. And you said, I'm sorry, I didn't catch the answer. Are there things you have to put in there? No, it's just, you're putting it in.
Correct. It's documented in the Omni cell.
Okay. So first you document the fact that we are going to waste this medication in the Omni cell.
Correct.
You then go to the receptacle, for lack of a better word, and you actually squirt that medication from the syringe
Yes.
into the receptacle.
Yes.
What do you do with the syringes?
Throw them away.
In the trash or something? Is there a special place for you to dispose of the syringes?
Yes, we have trash cans and biohazard trash.
Okay. When you dispose of the medication and you're inputting it into the Omni cell, are you also putting the reason that you're
Yes.
disposing?
Yes.
And where are you getting that reason from?
The doctors.
Or are you having to list the doctor's name that told you that?
No.
And you stated, I think you said something about the patient changed, and that's how you knew that you disposed of it. How did you know that you disposed of that medication? For Ms. Benning particularly?
Yes, in the report, it states that I wasted it, and under the reason it states patient condition changed.
Okay. And what report are you speaking to in that regard?
It's a continuation of this report.
Okay. A continuation, you mean medical records?
No, it's all of it's in the medication report.
Okay. On the document Defendant's Exhibit 1 that's in front of you, is that information on this sheet? So there's another document somewhere that states that?
Yes.
But it's not a UNC medical record?
Yes, it is.
Okay. Would your name be attached to that as well?
Yes.
Have you seen that document?
Yes.
When did you see that document?
It's the same one I was referring to, or I don't know when it was sent to me.
I'm sorry.
That's the one that was emailed to me. I'm not sure exactly when I received it.
In addition to Defendant's Exhibit 1?
I only received a strip that showed my name and then like what I did. I didn't receive anyone else's name. It just showed my name and what my involvement.
Okay. And that, was it a screenshot of the document?
Yes.
So then it would have been attached to an email,
Yes.
not the email itself. And what I mean by that is, you know, sometimes you'll receive an email and there's a screenshot within the email,
Oh, yes.
as opposed to an actual document that you have to click on and download to review.
Yes. I believe it was just an empty email.
in the email itself. And just so we're clear, because I don't want to confuse that, what you received is different than Defendant's Exhibit 1.
Yes, it's less information. It is only it has these two parts on here and only what I was involved in. It doesn't have, it's not the full of all the other medications. It's only what I was involved with.
Fair enough, thank you. And in Defendant's Exhibit 1, is it fair to say that Defendant's Exhibit 1 would be, if you look at just the two strips of where you were involved, would it be fair to say that the information you received is different than what's in those strips shown on Defendant's Exhibit 1 because it doesn't show where the medication was wasted?
Correct.
Because in Defendant's Exhibit 1, we don't see that, right?
Correct.
When we see the statement, "Do not tube must always be secured," what does that mean? If you know.
Oh, is that on here?
Yes, ma'am. For the record, what she says is that on here, she's looking at Defendant's Exhibit 1.
Where on the, oh, there it is. I believe it's referring to not, you can't send it through the tube system in the hospital like we send labs, because it's a controlled substance, so we can't just send it through the hospital. If we were, we would never have a reason to do that, but that's all that means.
Okay.
Is do not put it in the tube system.
Let's keep those separate and secure.
Yes.
When we see the status as active, what does that mean? On the right-hand side.
I do not know.
When you look at it, it says ordering mode standard. What does that mean?
I also do not know.
You see there where it says at the bottom package, and then it gives a number. Specifically under fentanyl, it says package 0409-9094-12. Do you know what that number pertains to? Fair enough. And finally, when you see frequency from 225.23 and 23.27 until discontinued, what does that mean to you, if anything?
I guess to me that's until they decide that we don't need it anymore, or until they discontinue the order.
Okay. And when you say they, you're speaking about the doctors?
Correct.
Okay. And to be clear, you would have nothing to do with the decision to administer these medications?
Correct.
Yes. Okay. And you would have nothing to do with the amount of medication that is determined that needs to be administered?
Correct.
When you, and if you know the answer to this question, you can answer it if you don't. When you see fentanyl, well, let me back that up. If someone was coming in for a potential overdose for any type of drug, would you expect to see fentanyl administered? If you know the answer, if you don't, that's fine.
I do not know the answer to that.
And reason being, because you're not the one who made those determinations, right? So that was an unfair question. I apologize. But what we can say is that we know for certain, based on the records you reviewed, that at 23:27 on February 25th of 2020, although it states that fentanyl was dispensed, you did not, and anyone to your knowledge, administer fentanyl to Ms. Jade Benning.
That is correct.
Now, let me get honest. So, Ms. Smith, we're going to, I'm done at this time, but, and this is beyond your purview, but I want to say it on the record. We would like for you to grab that document, that medical record, where it states that you actually disposed of it, so that we could at some point talk to you again about it. And we'll work with the prosecution to that regard, okay? But we do want you to look. Okay. All right, at this time, I'm going to pass you this. And for the record, I would just like to say that we're not done necessarily with this witness until we deal with the issue of this record we have not seen.
Okay, here, Jay. Who's the next witness?
Dr. Brooklyn.
And I believe, Ms. Hollins, this is in the medical records, but you mentioned it during the deposition. Do you want this marked as a separate exhibit?